Hello. Good evening, fellow friends and loved ones. Yes, once again, it's a very great privilege and a great honor to come to your homes um, as we continue our health discussions. It's been a couple of months from away from now, and we've had so many conditions to discuss about. So many conditions, I can't even mention them. So many conditions, various conditions, and you're welcome to today's discussion. Before we start today's discussion, we want to wish every mother a happy Mother's Day, potential mothers and those who are their children, and happy Mother's Day. And may the good Lord continue to protect them and care for them and guide them in all that they do. And we want to also bring to your notice on our nominations. Yes, we've been nominated for 2 awards, and we are treating all of us to go onto our page, our Facebook page, our Instagram page, our Twitter page. Yes, it's RICOY Health International Foundation, and actually we are seeking for votes. Yes, so there's a short code to go through. And we've been nominated for 2 awards. That is the SDG 3 Advocate of the Year award, and then the second one is Physical and Mental Disability category award. And so when you go to our Facebook wall, you will see all of them, and then we are entreating all of us to vote as many as we can. The voting has started. In fact, the voting will end on the 31st of July, so we have more time. We have May, June, July to vote as many as we can. Let's also share the flyers, and I'm sure yes we'll have the victory at the end on the 4th of September. Okay, so after everything, yes, we are now going to zoom on our on today's topic, and so may the good Lord start with us and end with us. And so today we are talking about a very interesting topic. Some of us who saw the flyers, and then some of us who pasted the flyers, and thank you very much. So we're talking about a very important condition. The condition is lower crossed syndrome. Lower cross syndrome is actually accompanied by stiffness or shortness of muscles at particular parts of the body, which we'll be talking about very soon. So our topic for today has the outline, the description, the clinical symptoms, that's characteristics, the causes, how we diagnose them, and how we treat them accordingly, and then some lifestyle modifications that we are supposed to adhere to. And so without much ado, we begin today's topic. And so it's called lower cross syndrome, scientifically called lower cross syndrome. Okay, so lower cross syndrome is actually in the German language or outside language called the Unterkreuz syndrome. Unterkreuz is spelled Unterkreuz. Unterkreuz syndrome, or you could call it pelvic cross syndrome, or lower cross syndrome, or distal cross syndrome. Actually, this condition is found mainly at the lower back, getting to the hips region, getting to our waist region, and it's accompanied by shortness or stiffness of some parts or some muscles in the body, which we'll be talking about in some few seconds or some few minutes time. Actually, this condition actually causes imbalances in the body. So you have some people or some persons having this condition tilted to a particular posture, which is abnormal from the actually normal person. And so these muscles create imbalances. So you have someone with a short back, someone with a very tight back walking like this. So very tight back walking like this, and this actually causes pain. Actually causes pain, discomfort, and actually some people could have very low self-confidence or esteem in terms of having very wrong posture as compared to the normal person. Okay, so actually this condition called lower cross syndrome could be as a result of overactivity. So if it's overactivity, probably someone sitting down for a long time could have shortened back muscles, and this could cause the person to have imbalances in the back posture, and then could cause also lower cross syndrome. So today, that much we do, we'll zoom into the picture column I'm sure last time we showed the pictures at the end of the presentation, but then today we want to start with the picture so that at least we'll have a fair idea of the condition. Okay, so let's zoom into. Okay, so yeah, so this is the condition. So these are muscles. So you can see the muscles. We have the muscles of the hip. You see the muscles of the hip. You can see them here. Yeah. So this is the back muscle, the buttocks muscle. So we have something we call gluteus maximus. This forms a major component of the buttocks. The buttocks. It's a gluteus maximus. And we have some under called the gluteus minimus and gluteus. So these are gluteus medius. We have the smaller one under called the gluteus minimus. These are all muscles that form the back, and they are components that when you have shortened form of them, you could have lower cross syndrome. Okay. So these are some pictures, anatomy of the back, and these are also anatomy of the back, and then the buttocks region. So these muscles are very important. This is called the psoas major and minor. This is called psoas major, and this is called psoas minor. These all form the iliopsoas muscle. This is called the iliopsoas muscle. In the case where we have shortened muscle called the iliopsoas muscle, this one, you could have lower cross syndrome. So any shortness around this part of the body, these muscles, that is from the lower back, you could have lower cross syndrome. And the anatomy of the lower back to the pelvic region, that's this region called the pelvic region, comprises of bones. These are bones, and these are also bones. And this whitish substance that is covering the bones are called ligaments, or we say fascia. So these actually cover the bones and prevents them from exposure to the other parts of the body. So if you have organs, around the side, so they protect the organs from having direct contact to the bone. And you have ligaments too here, which actually connects the bone to the bone. So ligaments here connect the bone to the bone, and we have tendons here which connect the muscle to the bone. Muscle to the bone are called tendons. Okay, so you have another structure here called the symphysis pubis. So this structure is very important. So any woman who is pregnant during the 9 months of labor, after 9 months of pregnancy, the labor time, this structure opens up and dilates to allow the baby to come out. So it's called the pubic symphysis. And this is the rectum where the feces go through the pubic tubercle. This is a pubis. This is a structure of anatomy of the body. Okay. And so this is also anatomy of the lower back to the buttocks region. So when you have shortened structures such as this, they could cause what we call the lower cross syndrome. So this is a very good and a very, very self-explanatory definition for the lower cross syndrome. So in the lower cross syndrome, the person will have a tight lower back muscle, a weak buttocks muscle, and then weak stomach muscle. So it could be like the person has a pot belly in such a way, not really a pot belly, but it could appear as a pot belly. But then with the tight structures at the lower back, it's a very, very key reason for diagnosing a lower cross syndrome. Okay, so another one too. So this is the weak muscle here. You can see you can see yes, that's the muscle here. We have the weak buttocks muscle, and then we have the tight lower back muscle. So we have the tight muscles around the hip region. This could present itself as lower cross syndrome. So this is a very good picture. This is a physical person. This is a physical, like a 3D drawing of a human being presenting with a lower cross syndrome. So the person has tight lower back muscles and then weak buttock muscles, and then that is called a gluteus. The buttocks is called gluteus maximus or gluteus medius or gluteus minimus in science terms. So the person has tight muscles in front. We call the iliopsoas. So around the side, we have a structure we call iliopsoas muscle. We saw it in the anatomy previously. And then tied back muscle. So the person tends to have this posture whilst walking or carrying out activities of daily living. So if you see someone walking in this posture, the person could likely have lower cross syndrome. So this is a very also good presentation. So you can see the person has protruded stomach region here, tied back muscles here, and the person too has a form of curved upper back we call kyphosis, hyperkyphosis. Okay, so yes, I'm sure we can see it. Hyperkyphosis, yes, hyperkyphosis, and the person also tends to have the neck protruded forward. So you can see the neck is going forward. The person has a curved upper back, and then the curved lower back pushing forward, and the curved upper back pushing backwards. Called the upper back is called the hyperkyphosis, and the lower back shortening is called the um. Sorry. Um, okay, so the upper back is called the hyperkyphosis, and lower back is called the hyperlordosis. So this is also another very good explanation for the condition called the lower cross syndrome. You can see it here. But anything that we have a lower, we have a upper. But we're not talking about the upper cross syndrome now. But this gives you a very good explanation that so far as we have a lower cross syndrome, you also have a upper cross syndrome. So that you can see the lower cross syndrome here. We have weak buttocks muscles or gluteus muscles, and then we have tight front muscles called the tight iliopsoas, the hip region. So we have just in front of the hip, we have the iliopsoas muscle. If you have tightness of this structure there, it could cause you to assume the posture that we saw initially. So you can see another one here. The person has tight lower back muscles, and the person has very, very tight front muscles around the side region. Okay, and it has a weak buttock muscles or gluteus muscles. So this shows the presentation for this condition. So this is where we have the weakness around. The weakness is here. The person has weakness here and has tightness around the side. These muscles become very tight and they assume a posture that is abnormal from the normal perspective. So this is a very good anatomy. And then we have a structure around the waist region called the pelvis. The pelvis bone is a very important structure. So it gives a very good posture whilst walking. If you have the pelvic bone, that is the bone, this bone, we show it very soon here. So let me show you a very good example of a pelvis. So this is actually the pelvic bone. So in the case where this bone shifts too much forward, this is your back. The person is facing forward like this. If this bone shifts too much forward, we call it anterior pelvic tilt. So if there is too much or hyper tilt of the anterior pelvis, then this could be a sign of lower cross syndrome, and their muscles, the shifting of the muscle forward could be as a result of tightness of the muscles at the back. So there's a muscle we call the erector spinal muscles at your lower back. This helps to keep this bone in place. So when there's tightness there, they shorten. So this muscle shorten like this. They shorten up like this, and they cause the bone to shift forward. So in the shortness of these muscles, it causes the shortening is like reducing the length. It causes the muscle to shift forward, and this could cause the bone, the body to change its position, causing lower cross syndrome. Okay, so the person presents in this situation. So you can see the muscles shorten here, and you can see the pelvis tilting forward. You can see the person is a very wrong posture. Okay, so this is actually the anatomy of the condition. You can see there. It's okay. Another one here. Okay, Another one here. This is upper core syndrome. We're talking about this one today. Okay. So these are some of the exercises that we do to strengthen the muscles at the back. You can see them here. The muscles are strengthened by these exercises. Are very good exercises by the physiotherapist. Also, exercise that, such as running also helps, but depending on the person's age, we also take caution so that we don't overstress other structures internally. Okay, so this is the summary of what I was talking about initially. The muscles that have been affected, or they are affected when someone has a lower cross syndrome. So this is a lower cross syndrome. So yes, so the tightness at the back, lower back. This is an example of the lower cross syndrome. The muscles present this way. As a result of tightness of the back muscles, the tightness, that is shortening of these muscles, causes this bone, the pelvic bone, to shift forward. So tightness going upwards causes the bone to shift forward, and this causes a tightness of the back at the back here, and causes abnormal posture, and then the diagnosis is termed lower cross syndrome. You've seen some exercises that we do. So this is a very good presentation of a physical person. That's a person who has lower cross syndrome. Okay, so without much ado, okay, so wow, we've had a lot of pictures, so many pictures that present us with a summary of this condition. So now I'm sure we'll be ready to join and understand the discussion as we carry on. Okay, so we've seen some anatomy of this condition. We've seen the structure we call the gluteus muscles or the buttocks muscles, termed gluteus maximus, gluteus medius, gluteus minimus, and we've seen muscles such as erector spinae. We've seen hamstring muscles. We've seen the bone called the pelvic bone, and then the ligaments. We've seen the tendons. We've seen the fascia. Okay, so these are some of the anatomy of this condition. And actually, this condition occurs, the lower cross syndrome occurs mainly at the lower back to the pelvic region and into the buttocks region. So when we have inconsistencies around these structures, then we tend to have lower cross syndrome. We'll be showing you some tests that we carry out as physiotherapists to be able to diagnose this condition. So in the case where the person has shortened lower back, we have a special test we call the Trendelenburg test. Trendelenburg test. So in this test, after the patient stands and then raises one leg up. So when the patient raises one leg up, the person's leg that is on the floor tends not to be straightened. That's it, the knee is not straightened. The knee is kept or bent forward. This indicates shortness or tightness around the muscles at the back of the knee, and then also tightness of the muscles at the back of the leg. Yes, so this could present with this condition called the lower cross syndrome. The other special test that we also carry out, which we'll be talking about very soon, I'm showing you some pictures, more pictures about this condition. And then we also have a test we call the Thomas test. So the patient lies on the back, and then one knee is bent forward passively. If you say passively, it means the medical practitioner, that is the doctor, the physiotherapist, specifically the physiotherapist, bends the hip forward. As it bends the hip forward, the other hip doesn't lie down, and then we have shortness around the hip region. So around this region, we have shortness around this region, and then this could present with our diagnosing of the condition called the lower cross syndrome. Okay, aside the diagnosis, when we notice, even with the posture, when the patient strips off or takes off the shirt and then exposes the hip region to the lower back region, when we see this condition, we are very, very, very prompt in terms of diagnosis. In terms of treatments also, we are very, very, very emphasizing. So we emphasize on the treatment, and the treatment is actually not to strengthen that side as a now. First of all, we're going to relieve any pain around that side. We have devices we call the ultrasound. So ultrasound also helps to reduce pain, reduce stiffness, also to allow the place to be stretched, to allow the person to be able to perform other functions as normal as possible. So we have the use of the ultrasound. We could use the hot pack or the hot water bottle around the side to relieve the pain and also to relax the muscles or the structures around the side. Aside that, then we start with, probably we can have a deep frictional massage around the side. It's the type of massage that we do to relax the muscles around the side. If it's the back, we do a deep frictional massage around the side to relax the muscles there. And then finally, we emphasize also on stretching. There are very specific stretching exercises that as physiotherapists we will teach the patients to go through in order to relax the muscles and then return the muscles to its normal function. And so there are exercises such as stretching exercises such as tranquil exercises, that is, the patient lies on their back and then bends both knees and holds the legs and pushes it to the stomach. And so the patient can do that and count maybe 10 or 20 times. And this also is very important to be able to ensure that the patient's back muscles are relaxed. And the patient also can do same also by lying on the stomach and then raising the leg backwards up. This helps also to stretch the muscles around the hip region. If there are tightness around there, or we notice through palpation, when we say palpation, we put our thumb around that side and feel some tenseness as a result of overactivity or underactivity of the muscles. Okay, so these are some of the exercises that as physiotherapists will go to the patient. So mainly this exercise involves stretches to relax the tight muscles at the back. And then if there's pain, we go through heat therapy, we also go through ultrasound. But then we are not really aiming to strengthen the side because already there is tightness around the side. We need to stretch the side of the muscles to be able to relax them. Okay, so we'll look at some of the exercises or the tests that we mentioned earlier on, and I'm sure we'll appreciate it the more. So we've been talking about the treatment, we're talking about the presentation, the anatomy, but what actually causes this condition called the lower cross syndrome? Scientists or researchers have found so many causes of this condition, and they say they have about 3 or 4 causes, but research is still being carried out. But one very important cause is trauma. So there could be maybe fall or an accident that involves the muscles at the back, and so the muscles, we have a term we call garden. So the muscles tend to contract or reduce in their shape in order to compensate for the injury at the back. Or if it's around the hip, if there's a fall forward or a heavy fall forward, the muscles also contract or shorten to be able to compensate for any injury around the side. Also, there could be improper sitting mechanics. So improper sitting mechanics is actually, probably you could be using a short chair instead of a high chair to be able to keep yourself in a good posture. Also, it could be improper sitting position. So probably you want to do a long hour work, and so you sit down in this position and bend your hips downwards. This could cause the muscles around the hip region to shorten, and this could, in a medium term or long term, cause this condition we call lower cross syndrome. These and many more. We have gait abnormalities. It could also be as a result of congenital disorder. So where we have at birth or after birth, you could have the shortening of the muscles called the iliopsoas, or the hip muscles, or the back muscles called the erector spine muscles. This will cause the muscles or the bones around the hip to tilt forward, called the anterior pelvic or pelvis, or the anterior superior iliac spine to tilt forward. The mechanism of this condition is actually as a result of tissue overload. That is, when you have too much stress around the hip region or the back region, it causes injury or shortness to the structures around the side, and therefore the person tends to experience pain because it's an abnormal position or structure of the body. And then the person also will tend to compensate by walking abnormally, and then we diagnose this condition and then treat it accordingly. Okay, so we'll be showing you some of the tests to be able to identify this condition as and when, as physiotherapists, we see it. Okay, so this is actually one of the tests that we conduct as physiotherapists. So you can see the patient lies down on the back and then tries to be able to. So we put our hands around the side of physiotherapist around the hip region. It's called the anterior superior iliac spine. So in this case, the patient tries to be able to bend the hip forward. So tries to tilt the hip forward, and by even palpating or by checking the distance between these two, there could be shortness around these structures, and this will be a very good indicator of this condition called the lower cross syndrome. So another one is the pelvic clock with hip abduction. So the patient bends the knee forward and then the leg on the bed with the knee bent. The patient also opens up the legs, and so when we check the distance between these two, this where the thumb is called the anterior superior iliac spine. So by bending or by opening up the legs, we could notice weakness of this structure called the stomach muscles, called the abdominal muscles. And when these muscles actually do not come to this normal position, we call it the lower cross syndrome. Okay, so these are also another test. So this another test called the pelvic clock with heel slide. So the patient with knees straightened forward tries to bend one hip forward. So in the case where there is weakness in terms of the bending, there could also be a diagnosis called the lower cross syndrome. Okay, there are so many tests that we do as physiotherapists to diagnose this condition. The patient can lie on the side, and these are some of the exercises, and then we check the muscles that are specifically important to be able to keep a muscle in its shape. So also lying on the stomach, you can see if there's shortness around this side, we could have lower cross syndrome. Okay. Alright, so we are still discussing the condition called lower cross syndrome. Okay, so you've seen some of the tests that we do as physiotherapists and also some of the exercises that we carry out as physiotherapists, and our aim is actually to restore the normal muscle length around these various very important structures, such as the front parts of the body, the hip, and then also the lower back. These help the person to assume the normal position or normal posture whilst walking and whilst carrying out his or her activities of daily living very effectively. So we've talked about lower cross syndrome and then the treatments to that, and then I'm sure so far we've learned a lot. Yes, and we've seen some pictures about this condition, and we've seen the treatment to this condition. In the case where the muscles still remain shortened, one very important other resort is to be able to do a long period of stretches, and these have been shown to improve the muscle strength in terms of the muscle length, because when the muscle is longer, there's increased flexibility, and then there is very good posture in terms of movement. Okay, so this brings us to the end of today's discussion, and thank you very much for your time. We talked about the condition lower cross syndrome, or tightness at the lower back, and we've learned also that it's not only at the lower back. We've learned also that it could be in front of around the hip region, that is the groin region. So we have a structure we call the iliopsoas muscle, and when they are shortened, they could cause the patient to assume an abnormal posture, which we saw at the initial part of our presentation. So thank you very much for your time, and today is the 9th of May, and thank you very much for your time. So if you have any question, you can just log on to and ask the question. You could see I saw Jude coming in, saw Joanne, I saw Eric, and many more also watching. I saw Mr. Ashon, yes. I can see other people joining also, yes. So this is actually a wonderful time. I'm sure we've learned a lot. If you join in the middle of the presentation, don't worry at all. The video or the discussion be uploaded on our platform, and then on YouTube also, so you can watch on RICOY on YouTube, and then it will also be pasted back onto our Facebook wall. You can share the presentation to your various friends and loved ones. And we'll be back next week for our next presentation. And our next presentation is actually a very interesting one indeed, and it's titled Temporomandibular Dysfunction, or to simply put, jaw pain and discomfort. So if you have jaw pain and discomfort, you don't only need to see the dentist, but there are also exercises that we do as physiotherapists as a diagnosis to be able to take the pain off and also to strengthen the muscles around the jaw. So let's keep in mind that if you have jaw pain, it doesn't mean you have to see the dentist, but there are instances where it requires you to see the dentist, and even when you see a dentist, you are referred to a physiotherapist for some exercises. Thank you very much for your time. May the good Lord be with us all. Have a wonderful and have a blessed week, and let's keep the votes coming, and let's check on our flyers on our award that we have been nominated on. The first one is the SDG3 Advocate of the Year Award, and the second one is the Physical and Mental Disability Award. Let's check on our Facebook wall, and I'm sure we'll have the procedure carried out. And let's vote as many as we can. The voting ends on the 31st of July. Have a blessed evening. Take care. Bye.